Good evening and welcome to the short presentation from iMEDicare Pelvic Health Naturally, who distribute Rigicon innovative urological device solutions exclusively in the UK and Ireland since 2016. Testicular prosthesis produced from various materials have been in use since 1941. The absence of a testicle has been shown to be a psychologically traumatic experience for men of all ages. The indications for insertion of a prosthesis include absence or following orchidectomy from a number of causes such as malignancy, torsion, and orchiditis. The most common substance used around the world in the manufacture of these implants is silicone. However, in the US, this material is currently banned because of theoretical health risks. This has led to the development of saline-filled prosthesis as an alternative. The absence of a testis from the scrotal sac represents a psychologically traumatic experience in males of any age, from childhood to the elderly. Testicular loss may arise following orchidectomy for torsion, maldescent, trauma, infection, or malignancy. Testicular absence is seen in cryptorchidism from either an undescended or ectopic testis. It may also be a result of testicular agenesis or atrophy following intrauterine torsion, the vanishing testis syndrome. Such patients may at some stage request the implantation of an artificial testis for cosmetic or psychological reasons. This is more likely in patients who have lost a testis compared to those born with an absent testis. Female to male transsexuals may also seek a testicular prosthesis as part of their gender realignment surgery. What is unique with Rigicon? Rigicon is the only medical device company with a dedicated focus on prosthetic urology and is the one-stop source for erectile restoration, testicular replacement, and continence management with novel surgical tools. The first prosthesis used in 1941 was composed of Vitalium, an alloy of cobalt, chromium, and molybdenum. During the 1950s, numerous other materials, including glass marbles, were used. Gel foam was specifically injected into the tunica albuginea following intracapsular orchidectomy performed in patients with metastatic prostate cancer. Plexiglass, Dacron, and polyethylene prosthesis have also been used without much success. It was then suggested that the ideal testicular prosthesis should be chemically inert and should not elicit any inflammatory or hypersensitivity reactions. The material should also resist mechanical strains, take and hold the desired form, be amenable to sterilization, and be a proven non-carcinogen. As a result, silastic and solid silicone rubber prostheses were developed for use in the 1960s. The demand for more natural feeling implants led to gel-filled silicone devices appearing in 1972. A firmer silicone-coated product became the standard prosthesis in 1988. However, in the US in 1992, the Food and Drug Administration halted the use of gel-filled breast implants due to the theoretical risks of connective tissue and autoimmune disorders, the question of mechanical instability, and the remote possibility of tumor development. In a study of patients who had previously undergone insertion of a penile prosthesis, silicone particles were found in 18 of 25 operative tissue specimens and in 4 out of 4 specimens obtained from the regional lymph nodes. This clearly demonstrated that there had been a leak of silicone into surrounding tissues from the prosthesis, albeit in small amounts. Despite this, no subsequent evidence has been found of a link between usage of penile or testicular prosthesis and connective tissue diseases. A prospective study assessing the safety profile of the Mentor saline-filled prosthesis was then undertaken by Turek et al. They studied 149 adult and pediatric patients from 18 institutions and assessed various parameters such as connective tissue disorders, complications, and quality of life. At 1 year, none of the patients had developed connective tissue disorders, and they concluded that saline-filled prosthesis appeared safe and well tolerated in the short term. In contrast to breast implants, where there are over 35 articles looking at post-operative patient satisfaction, there have been very few quality of life studies reviewing the outcomes of testicular prosthesis insertion. This is surprising, as improvement in body image is the only real indication for insertion of testicular prosthesis. A study of 19 patients by Lynch et al. Suggested that most men were happy with their implants and body image. Two other studies have retrospectively looked at overall patient satisfaction. Adshead et al. Found that 91% of patients who replied to their questionnaire felt it was extremely important to be offered an implant at the time of orchidectomy. This study also showed that 73% of those who received a prosthesis felt they had an excellent or good result. However, 23% were dissatisfied because of the shape or position of the prosthesis. Incroci et al. Documented that 68% of their patients reported a significant improvement in body appearance, with only one patient, 5%, dissatisfied. In the only study to evaluate testicular prosthesis implantation prospectively, Turek et al. Found, using the Rosenberg Self-Esteem Scale, the Body Esteem Scale, and the Body Exposure in Sexual Activities Questionnaire, that insertion of a testicular prosthesis led to quantifiable improvements in self-satisfaction, self-esteem, physical attractiveness, and positive feelings during sexual activity at 1-year follow-up. We shall now spend a few moments investigating the testicular prosthesis produced by Rigicon, which exists amongst a portfolio of highly exciting and innovative prosthetic urological device solutions, including malleable prosthesis, inflatable penile prosthesis, and artificial urinary sphincter devices. Most of these devices are available on the current NHS supply chain framework with lifetime warranty. Rigicon produced two models of testicular prosthesis in the Testi10 series. The Testi10 saline pre-filled comes with an embedded suture loop and injection port, and the Testi10 firm is solid silicone with a mesh on one pole for fixation if required. The saline pre-filled option could be the natural choice for patients concerned about silicone migration, also known as gel bleed, whereas the Testi10 firm could be more applicable to patients engaging in high energy, intense sporting activities. Both options are very competitively priced, and surgeries are supported by the iMEDicare surgical team. Both models of Rigicon Testi10 come in 5 size options from extra small to extra large. All size options are ovoid in shape to offer further reassurance to the patient that the prosthesis will look as natural as possible. The table currently visualized indicates the volume of each of these size options from 6 to 26 milliliters from extra small to extra large, and their associated dimensions, which makes it easier for the clinician to identify which size option is suitable for each patient. The same is true with Testi10 firm. The size options are exactly the same volumes, same series of dimensions. In conclusion, testicular prostheses have been shown to reduce the psychological impact resulting from loss or absence of a testicle. Implantation is technically simple if performed at the time of orchidectomy. A low groin incision and antibiotic usage is associated with low complication rates. The long-term fears associated with silicone implants, namely connective tissue or autoimmune diseases and carcinogenesis, have not been substantiated. Even though silicone implants are still widely used in the UK, only saline-filled implants have FDA approval in the US. Whilst the short-term results of the latter show them to be safe and effective, longer-term quality of life results are still pending. If you would like more information about the Rigicon series of testicular implants, please do not hesitate to visit our website mypelvichealth.co.uk or email contact@iMEDicare.co.uk. Thank you very much for your time and attention.